go to Dr. Binmoeller in room 16. Thank you.
All right, this is really tricky because this is right behind the IC valve, and I have a very unstable position, and it's also kind of dirty in here, right? So I'm constantly having to clear my view. But what I'm trying to do is allow this to float up as much as possible. This is right behind the IC valve, and I'm going to use the snare now to help shift this away so that I can scoop it underneath. So I'm using the snare and just pushing this away, waiting until I can maybe find a plane to scoop the snare underneath, right? You see how I'm pushing this away? And I'll keep doing that, but there's a part on the right side that I don't think I have in the snare. So this may not be on block in the end, although I really would like it to be. I'm going to try to maneuver this just a little bit more to see what I can do. Kind of pull back. With the water, I can distend a little bit more and see how it is. I'm trying to scoop this. It's a little bit of an umbrella type polyp, right? So it kind of overhangs. So I have a chance. And I'm going to ask Heiko to hold the scope because it's such a unstable. See how it kind of just floats like this, but I'm losing my position again. But it's okay. I'm going to let everything just sort of float and just wait. You have to have a lot of patience with this when you have poor control of your scope. And right now, it's sort of like I feel like I'm in outer space, right? And it just sort of floats away from me.
It looks like you're getting there, Ken. What size and type of snare are you using?
It's a 33, and I intentionally chose a big one because this is a big lesion, and I would like to get it out on block if possible. But let me just I'm just trying to get this to swivel over this way, turning like this, slowly. So it just demonstrates how much patience you have to have when doing this. And then I have the assistant. So it looks like on the left side, that snare is not quite getting the left side. So I'm just sort of moving.
And it looks like you're pumping water continuously. Do you ever let your foot up off the pedal?
I'm putting a lot because I need that distension to see. And I'm just trying to see what I can do to turn this so that I can get that left edge of the snare underneath this, right? Now it's looking better. Now I'm going to do that jiggle that I talked to you about like this, right? And then you just start to close the snare, and I want to just sort of see while I'm torquing and crimping and then when it's, just hold it there because I want to see how it changes color and want to get a sense of how much I actually captured. So I don't want to cut through anything. I'm looking at the color change. All right.
What do you do to make sure that you don't have anything on the back side?
All right, I'm doing the rotisserie, the French rotisserie here. All right, so I'm torquing like this. À la foncée, oui?
Très bien. This looks good.
Vous voulez votre poulet bien cuit? Okay, so now I think this looks pretty good. I'm just doing the rotisserie like this. It looks like the whole thing is nicely violaceous. And I may have to trim this a little bit more. Maybe I didn't get the bottom part. I'm looking at the far left. But that looks like normal mucosa to the far left. So I'm pretty happy. This is really a tough spot, right? Because it's right behind the IC valve. Now, it's called the 2Bs, all right? Bubbles and blanching. So you're just going to hold it like this till you see some bubbles appear and you see some blanching. I'm on auto cut 1.6. So this translates with the old Vial 300. It was 5 effect and 80 watts. That's what I used to use, auto cut. No, we don't have those settings anymore. So it's 1.6, and then I have force coag 6 if I need some coagulation. For these really villous lesions, I will use some coag, force coag. But I would tell you down in the cecum, you got to be very careful. So the idea with using AutoCut here is to wait. So this is different from Doug's technique where he cuts through pretty quickly. I'm waiting. I'm gonna wait while I'm tapping till I see some bubbles and blanching, and then the nurse is gonna cut through. All right? And then while I'm doing this, I'm gonna take advantage of the heat sink effect, and I'm actually gonna give water while I'm doing this. So I'm ready to step on the yellow pedal. Here we go. Wait, 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 start, cut. There it is. All right, so you saw the bubbles and the blanching. Now we got a little bit, put the snare out just a tad for me, just a little bit, and then recess it. Right away, recess it back, stop, a little bit more recessed. Now I can give some water here, and if it doesn't get too cloudy, see that there, right there? But if I can hold the scope for me, if you're very careful, and just make sure that your snare is inside. Push. No, it's good. It's good. It's good. See, it coagulated. That's all you need. I always keep the snare recessed in when I make my dots, right? See, you can get it nicely there. Good. And that's using auto cut. I can use force coag to get more effect if I want more. Look, see, you get this spark. This is force coag. So now I can get, and you're just hovering above the MP. That's all. And I want to make sure, see, I've got the heat sink effect, which I think is so important. It's preventing the deep thermal injury. Now, the next thing I'm doing is I'm going to scout around the perimeter. I'm interrogating around the perimeter. This is where you, of course, need to have really, good high def. And I'm looking to see if anything looks like there's residual adenoma. See, now is that normal? I think it's normal on the left side. I can trim that here. By the way, what you're looking at, that's that crisscrossing. That's some mucosa. The muscle is behind there. That's not a perforation. So when you don't be afraid, that's normal there. That's not a perforation. All right. So now I'm just going here. There's a little vessel. I'll get that little vessel here. You can even push down against it a little bit. It's not a problem. This is not coaptive coagulation. There. So if you did this with a hot biopsy forceps, you'd perforate. But with the snare recess like that, it works for it. Look at this. The margins look, I think, beautiful. All right, now what I do is we get biopsies from the margins, but I love to, I close these always, and I use the DAT clip. So do you have any DAT clips?
I can.
Ken, this was a fantastic demonstration. Doug, do you have a comment before we
Okay,
move
so
to
if-
Ecuador?
This one,
No,
If
I
you're
just think it was,
concerned, I'll trim it for you. All right, just for you, Heiko.
I would just want to be on the safe side to get this off, and I probably would use the cold snare for this one.
Cold snare?
Because this is
Just
a
give me a
pretty
10.
large snare to engage that again. And
I'm happy to show it to you. I do this underwater too. I'll trim this. I'd love to show you trimming.
here in the middle,
Okay.
you could maybe even use
Okay,
and see if
Ken and Heiko, while you talk about trimming the polyp, we're going to move to Ecuador, but I do see a guest just behind you.